The topic I was assigned was polycystic kidney disease, which is often abbreviated as PKD. It's a disorder which is either inherited it's inherited or genetic, where cysts develop within the kidneys, causing the kidneys to enlarge and lose function over time. The cysts are non-cancerous round sacs containing fluid and can grow, varying in size, and can grow very large, causing damage to your kidneys. There are two main forms of PKD: autosomal dominant and autosomal recessive traits. And the PKD is distinguished by the patterns in which it is inherited. So for autosomal dominant, you would have a 50% chance of acquiring this disease from your parents. As you can see in this diagram, if your father was affected and your mother was unaffected and they had 4 children, there would be 50% chance. So that would mean 2 out of the 4 children were affected, and then 2 are not affected. This makes up about 90% of the cases for polycystic kidney disease, which makes it the most common disease. The symptoms usually start to develop between ages 30 and 40. And because of that, it used to be called adult polycystic kidney disease, but then we found children can also develop this disorder. The second form is the autosomal recessive polycystic kidney disease, and this one is when both parents have the mutation, and so but they only have they're carrying the mutation. They don't actually have the disease. So because they're carrying it, there's only about a 25% chance of acquiring the disease. So if they had 4 children, 1 would have the disease, 1 would not have the gene or the disease, and then 2 of them would carry the gene, however, would not have the disease. This type is far less common, where multiple cysts are present at birth. Symptoms of the disease include hypertension, frequent urination, kidney infections, kidney failure, frequent headaches, flank pains. So the pain can be on your lower back and radiate to your flank or your side. Increased size of the abdomen due to enlarged kidneys. Sometimes you could see a tinge of blood in the urine. Could be like pink. And infections, urinary tract infections or kidney infections. Complications associated with PKD include high blood pressure. The increased blood pressure is a common complication of this disease, and if it goes untreated, it can further damage the kidneys and increase the risk for heart disease and stroke. The provider may prescribe medications for hypertensive control. Another complication is loss of kidney function. Since this is a progressive disease, progressive loss of kidney function is one of the most serious complications of PKD. Nearly half of those with the disease have kidney failure by the age of 60. So here's just a little diagram where you would have a normal kidney and then a kidney with PKD with all the cysts. And then as it progressed, the kidney would become impaired with decreased ability to filter and function until ultimately having kidney failure. PKD can interfere with the ability of the kidneys to keep waste from building to toxic levels. The disease worsens as time goes by, causing end-stage kidney or renal failure, where patients would need to be ongoing with kidney dialysis or would need a kidney transplant to prolong life. The provider may request laboratory tests such as a urinalysis on a urine sample and blood work to monitor the creatinine and urea levels. Pregnancy complications also may occur. Pregnancy is successful for most women with PKD. In some cases, however, women develop life-threatening disorder called preeclampsia. Those most at risk are women who already have high blood pressure before becoming pregnant. Another complication is the growth of cysts in the liver. The likelihood of developing liver cysts for someone with PKD increases with age. While both men and women develop cysts, women often develop larger cysts. Female hormones may contribute to the cyst development. A brain aneurysm is another complication where a balloon-like bulge in a blood vessel in the brain can cause bleeding. If it ruptures, people with PKD have a higher risk of aneurysms, and people who have a family history of aneurysms have higher risk also. Heart valve abnormalities. 1 in 4 adults with PKD develop mitral valve prolapse. When this happens, the valve no longer closes properly, which allows blood to leak backwards. Colon problems, weaknesses and pouches or sacs in the wall of the colon may develop in people with PKD, causing constipation and diverticulitis. You may be asked to increase your dietary fiber, increase fluid intake, and ambulate frequently to prevent constipation. The provider may also prescribe stool softeners. Chronic pain is another complication where pain is a common symptom for people with PKD. It often occurs on the back, lower back, the side, flank. The pain can also be associated with a UTI, a kidney stone, or malignancy. The provider may prescribe medications for pain management such as NSAIDs or non-steroidal anti-inflammatory drugs. The provider may also prescribe non-pharmacological methods for pain management such as relaxation, deep breathing, and applying heat to the abdomen or flank areas to reduce discomfort. Lastly, another complication is infection, where symptoms for infection include lower back, radiating to the flank, fever, nausea, vomiting, urethral discharge, urinary frequency, increased urinary frequency, anergency, burning upon urination, and itching. Older adults may also experience confusion, incontinence, and loss of appetite. If the provider diagnoses you with an infection, antibiotics may be prescribed, such as ciprofloxacin, upon others. For prevention of PKD, keeping your kidneys as healthy as possible may help prevent some of the complications of this disease. One of the most important ways you can prevent the kidneys is by managing blood pressure. Some tips for keeping the kidneys healthy would be taking the medications as prescribed by the provider and as directed. Eating a low salt diet containing plenty of fruits, vegetables, and whole grains. Maintaining a healthy weight and monitoring that weight daily. Asking your provider what the right weight is for you. If smoking, quit. Regular exercise is recommended, at least 30 minutes of moderate physical activity most days of the week. Limit alcohol use. Obtain labs requested by provider, and follow up with your provider as directed.